We have all been there or seen a movie that involves a pregnancy. Whether it is planned or a pleasant surprise, there is always a bit of shock and awe when you first find out you are expecting. It is easy to get quickly overwhelmed with the thought in 9 short months you will have a brand new little human who is depending on you for everything they need to survive. Stay calm though. There are 10 ways you can prepare for the birth of your baby before they are born. I believe I have some great expertise on this topic because I have prepared for the birth of all 3 of my kids, who are now 6, 4, and 10 days old. Today I will be sharing the 10 ways to prepare for the birth of your baby and how to split them up among the 3 trimesters the expectant mom goes through. During the pregnancy, a woman goes through 3 stages, which are called trimesters. In weeks 1 through 12, a woman is considered to be in the first trimester. You want to start learning about the birth process as early as you can because you can never learn too much. Things that you can do are look up pregnancy guides. There are websites and phone applications that you can download. An example would be what to expect when expecting, which can be found at whattoexpect.com, which gives you a weekly update on what's happening with baby's growth and your body. You can also take birth classes such as stages of labor, pain management, breathing techniques, and medical equipment that the doctors are going to or might use during labor and delivery. Watching videos is also a great thing to do on the internet in creating a birth plan. Just remember, it is never too early to start preparing for the birth of your baby. The internet and phone applications in today's society have made it so easy to get the information you need. In the second trimester, which is weeks 13 through 28, is a great time to start knocking off some to-dos in preparation for the birth of your baby. You want to start stocking up on essentials such as car seat, crib, bassinet, whatever the baby will sleep in, diapers and wipes, clothing, and toiletries. It really is never too early to start stocking up on this because you don't want to wait until the last minute and then have huge purchases to make. You also want to find a doctor for your baby. That is extremely important. If you have any older siblings, will you use the same doctor? You also want to make sure you allow time to find one. Don't wait until the last minute and sacrifice finding a doctor. Find a doctor who accepts your insurance and is taking new patients. And also speak with your health insurance company on how to add baby to the policy and which doctors are in network. And if you don't have any doctors in mind, go ahead and speak with friends and family to get referrals. You also want to be on the same page as your partner. You might think you are, but unless you have discussed it, you might not be on the same page. A great way to start that would be to discuss a birth plan. I went ahead and printed off a sample birth plan from Methodist Women's Hospital, and I will pass these out. Here you go, and then I will go over some of the things with you. Things to discuss and include in your birth plan would be the baby's gender. Obviously, you guys might know that or might not know that, but also to let your nurses and doctor know. Your labor support, who will be in the delivery room with you. What kind of environment you want in the labor room. Hydration and oral fluids, whether you will be drinking clear liquids throughout labor or if you will be hooked up to an IV and have your liquids that way. Fetal monitoring, whether you want intermittent fetal monitoring or continuous. How you would like to relieve pain, whether or not you want pain medication. And then obviously when greeting the baby, whether or not you want the baby to be up on mom or dad to hold her, however you want. And then also, what better way to learn about birth and baby care than to talk with those who have been there and done that. Speaking with veteran moms can give you great insight into birth and how to care for baby. Oh boy, you are 2/3 of the way through pregnancy. By now you are ready to do the last minute preparing. You are now in the home stretch. Weeks 29 through 40 are when the expectant mother is in the 3rd trimester. My favorite thing was packing the hospital bag. That just meant that we were getting closer to actually having the baby. Here is a list that I created that I found the most helpful when packing my bag, but obviously you can always create your own list or look on the internet for other lists. Things that the mother is going to need is going to be like a nightgown, robe, nursing bras, and breast pads if they are breastfeeding. A going home outfit for yourself, socks, toiletries such as shampoo, conditioner, body wash, chapstick, deodorant, toothbrush, toothpaste, things like that. Also a camcorder, a camera. And then for baby, you want some outfits. You want a receiving blanket, mittens for their hands, and then socks. And also, don't forget the car seat and a diaper bag. And then don't forget about your partner, who will probably need just about the same stuff as you, toiletries and clothes. If you do already have children, preparing the older siblings is a great idea. Use the internet. The internet will give you a bunch of great ideas on how to prepare them for the little one. Also, decide who is going to attend the birth. Personally, I think it's a great idea. The fewer people, the better. The more people in the room, it tends to get more stressful, and especially if there's an emergency that comes up, it's best to have as few people in there as possible. And then know what to do when labor starts. Who to call, how to count contractions, and routes to the hospital. Plan a couple of routes in case when you do go to the hospital there are a few detours. The final stage of preparing for a baby is probably the most exciting. Why? Because you are that much closer to having your new bundle of joy. In conclusion, 9 months doesn't seem